Hello, my name is Kyla Hecht,
Hi, my name is Martina Hyacinth.
and we're going to be presenting the Chinese culture. So, China is located in Southeast Asia along the Pacific Ocean. It's also the third largest country in the world. They mainly speak Mandarin and Cantonese. 90% of the Chinese culture speak Mandarin, the rest speak Cantonese, and then the rest of the percentage speak a bunch of different dialects. Family roles. Professional skill and knowledge is valued because it's the family's responsibility to care for the patient when they're elderly. So if you have a patient in the hospital, the family will help with feeding, bathing, toiletry, because it's their role. Physical features. In the picture presented below, you can see they have fair skin tone, bigger eyes, black hair. They're also known to have less body hair. They have flatter faces, wider cheekbones, smaller nose, and they average between 5'5" and 5'7" feet tall. Nutrition. So a meal will consist of one carbohydrate or starch, such as rice, noodles, or mantou. They mainly use rice, and they have accompanying dishes of vegetable, fish, or meat to go with it. In pregnancy, all married women are expected to have children, and having a son is valued over having a daughter. During the early stages of pregnancy, the women are expected to relax and rest and not lift anything heavy. They're also advised not to eat cold foods during pregnancy to reduce the risk of having a miscarriage, and to avoid sharp objects when on the bed, like scissors and knives, because it's believed that is the cause of cleft lip. High-risk health behaviors. Due to adapting to Western society, their health has been impacted. There's been an increase of breast, colon, and prostate cancer compared to the Chinese people who are living in China and Hong Kong. Common diseases are alcoholism, nasopharyngeal cancer, liver cancer, thalassemia, and glucose-6 dehydrogenase deficiency, which is another form of anemia. Healthcare beliefs and practices. So it's believed that pain comes from the hardship that previous generations had to endure. They also believe in yin and yang, 5 elements, and Buddhism. So attitudes to healthcare practitioners. The Chinese culture, they may present as the perfect patient. They may not ask for any medicine. You can't really tell when they're in pain, so you need to look for nonverbal cues. Use the FACES scale.
Okay, death ritual is done as a sign of respect to the deceased, and to prepare for the wake. The family remove everything in the living room, all the furniture, and the wall is covered. All the mirror, everything is covered on the wall, and for mourning garment. The closest family, they wear special garments. Um, Depends on the relationship. Each person wear a different color. Well, to prepare for the body, the body is washed by the eldest son, and and then for the coffining of the body, the it is required to add certain things in the coffin, such as personal articles. Rice. Rice is placed in there to help, so the person can always have something to eat in the afterlife, and also coins is placed in there to give to the spirit. And also pearl is placed on the person's mouth to also help with transitioning to the afterlife. And burial or cremation is done before the burial. Before the coffin is closed, the family and friends are able to pay their last respect, and then depends, like in Singapore, since the population is overcrowded, most people are cremated, and the urn is either placed in a at the house or at a local area where urns are placed and people can go there to pay their respect. How to show respect for their belief regarding birth, death, or religion. It is important to show respect, to be respectful. If the patient wants alternative therapy, it is our job as nurses to provide that to help make it happen. And you should also incorporate that into the patient's plan of care. Eye contact is considered impolite, so nurses have to keep that in mind when caring for a Chinese patient, to not look into the person's eye directly. And smiling may indicate confusion or embarrassment. And those are things that nurses have to keep in mind. Ethical dilemma. Chinese culture believe that if you talk about the end of life or bad events, that will make it occur. So be careful when word your conversation properly in order not to say something that will cause any problem with your patient. Involve the family as much as possible, and then include traditional medicine, and avoid terminology that will cause any concern or any problem.